Hi everyone, we're starting in the next 2 minutes. If you can hear me, please say yes on the question bar. All right, that's very good. We're receiving lots of yeses, so I can see that everyone is able to listen to us. If you have any questions regarding your OET writing section, please send us questions now, but you'll have opportunities to ask questions in the end as well. All right, so we're getting lots of questions, but we'll start the session now. Please say yes if you can see me on your screen. All right, excellent. So hi guys, my name is Bhavna. I'm a medical registrar working in the NHS. I started my medical career in India and then I moved to the UK about 7 years back, and I've been working here and I got all my certifications from here. So I should be similar to, I was similar to you about 7 years ago when I began my journey towards working in a foreign country. What I get really frustrated with the OET exam is the fact that lots of people who are excellent doctors or nurses, they often struggle with the IELTS or OET just so that they can begin their careers and just prove themselves to be good doctors. So that's a little bit annoying, but hopefully we'll try and cover a very difficult aspect on the OET test, the writing today, and we'll try and solve some of our problems which we face as doctors or nurses coming from foreign countries attempting this exam. All right. So the first question that everybody asks me, why do we struggle so much with the writing section on the OET exam? I first asked them to just go through the official OET criteria and then just judge from them for themselves what exactly are they asking on the OET section and why is it important as a doctor or a nurse who's coming to work in the UK. Now, the OET writing section is very similar to what your everyday clinical practice will be when you come and work with us in the NHS, or if you go to Australia or any other foreign country. So the format that we have for the OET writing is very similar to an average clinic letter, which if you're working as a doctor, every time you see a patient, you're supposed to write clinical letters to their GP if you're a specialist, or if you're a GP, you'll have to write letters every day referring your patients to their respective specialist or respective district nurses. So it's very, very real. So it's very, very similar to what you would have to do every day. So it's very good that the OET writing section is actually testing it for us. Similarly, things like writing notes on your rounds or writing patient summaries, all of them are very similar to what you face on the OET writing section. So what they're trying to assess is your ability to use the notes provided to you, convert them into understandable sentences, which aren't a cut, copy, paste, but rather you're able to write proper sentences out of the notes provided to you. So that's what we essentially call paraphrasing. This test also makes sure that the medico who's being tested doesn't make loads of grammatical mistakes. I mean, they don't want your exam to be perfect English, but they want it to be normal English that you would use in day-to-day life when you come and work in the NHS. So that's quite good compared to the IELTS, where you actually have to go through elaborate paragraphs and elaborate stories which aren't really relevant to your field of practice. Another thing which people often miss is that the OET writing section emphasizes that you're able to be aware of the basic clinical communication criteria. What are the things which would make a proper clinical communication? That's also being assessed while you're giving the OET writing section and on your speaking as well. So it's quite good. I really like the OET exam compared to the IELTS because of the fact that it prepares you so much for your subsequent exams, especially if you're planning to give the PLAB, the MRCP, or you have your CBT certification. So it's very, very relevant, and it prepares you to be better doctors and better nurses, especially in a foreign country. Right. So guys, we've given you a handout with official OET writing criteria. You can also see it on the screen right now. So you can see that the writing is actually evaluated not just for grammar, but for other categories as well, which are your content, your conciseness and clarity, your genre and style, your organization and layout, and your language. The official OET website states that in order to get a B grade, you need to score at least 5 out of 7 on content, clarity, genre and style, organization, and language. And for the field of purpose, you should get at least 2 out of 3 in order to get a B or a pass grade. We'll try and go through what exactly is needed on all these sections. And then on this masterclass, I'll try to cover the main things which are making people fail on their OET writing subtest. Now, the criteria are also given on the screen and they're also on your handout. So please go through the handouts once we're done with this. The first criteria that they try to evaluate is purpose. This is very, very important. And this is often a thing that we find that people stumble on. So purpose is actually when you're given a task, they try to assess, so they'll try and ask you to do something through that task. Let's see an example of what was in previous OET tests in the previous months. So there was one letter which asked you to make a referral to a psychologist. This patient had a surgical problem, but the referral was to a psychologist. So the purpose of the letter was to refer this patient to a psychologist, but the confusing thing was that in the case notes they also mentioned that this patient has already had a surgical referral done. So identifying that your actual purpose is a psychology referral rather than a surgical referral was the essence of that task. And people who confused that, they failed this exam because of messing up the purpose. The next criteria which they try to assess is content. Content is whether you include everything which is important to your purpose. For example, if your main thing is that you have a patient who's had a bleed on their brain and you're supposed to refer this to a neurosurgeon, so providing all of the information regarding this patient's history, how they presented to you, and why do you think they've had a bleed on their brain is important and will form essential part of your content. Conciseness is clarity, is whether you're able to exclude the information that is not needed. So things like if you have some relevant history, for example, you have a lung cancer patient and they've got a lot of history of smoking, that's content, so that's necessary information. But whether they've had 3 marriages or they've had 15 children isn't really important or relevant to your scenario. So people who include irrelevant history, they get marked down on this category. Genre and style. So this is something that we struggle as international doctors who come and work in foreign countries. It's very important that the language that you use is appropriate to medical communication. For example, if you're talking to a consultant, you won't talk to them in the same way that you talk to your friend or you talk to your junior colleagues. So it's very important that your language is appropriate and it's medical and it's polite. So that's also something that we struggle with. We'll try and cover all of the mistakes that we make in this lecture later on. Organization and layout. We've had lots of questions from people regarding what they would find to be an appropriate layout. So we do have a blog on this on our website as well. So if you go to www.teacheracademy.com, you should be able to find it, but we'll try and cover it briefly here as well. And language, which often people find is the main thing that they struggle on. We'll also try and cover that. And that's also a part of the assessment criteria, but it's not the only criteria. So we just need to understand that. All right, now I bored you a lot with assessment criteria, but I know why we've all gathered today, because yesterday was result day. We had lots of people who failed their OET attempt. Maybe it was their first attempt or they had multiple attempts in the past, and we found that a majority of our students, they actually fail on the writing section. So it's something that's quite frustrating, especially if you all are senior doctors or senior nurses, obviously quite respected in your fields, and you stumble upon writing a letter and you're not allowed to practice as doctors or nurses. It gets really, really frustrating. So that's why we've gathered today, and that's what we're going to try and cover, the things which make you fail on the OET writing. Language. I try to reiterate this loads and loads of time. The thing which you will not pass, you will definitely not pass, is if your language or your grammar isn't okay. We often find people that they keep on giving the OET test again and again and again, and then they keep on failing, but they don't realize that their main problem is that their grammar isn't good. If you have a letter which is excellent in its content, excellent in its clarity, but it's got bad English in it, you won't pass. If you've got bad English and if you've got bad grammar, you won't pass your writing, you won't pass your speaking. And unless you work on this, you will, I'm not trying to discourage anyone, but you will not pass your OET. So working on grammar should be your first priority on the OET. Now, it's not important that you have perfect grammar. No doctor, no nurse has perfect grammar, even if they're born and brought up in a foreign country. You need to make sure that your grammar is acceptable and your English is understandable. What I advise all of my students to do is work on 4 things: paraphrasing, articles, tenses, and basic spelling mistakes. What paraphrasing means is that we've provided, if you check your handouts, we've provided a writing check sample, which basically goes through a sample note and it assesses all of the points which we try to assess on the writing check. So that should be useful if you want to learn about paraphrasing. Paraphrasing basically means trying to convert the notes which are provided to you into understandable sentences. What I often ask my students or my medical colleagues who are preparing for the OET test is to try and take case notes which they have every day. So every day when you walk into a ward, you have your notes in front of you. You always write notes, you write case notes, you write surgical notes, you write nursing notes, which are often short forms. or they're short. They're not actual sentences. They are pieces of sentences. I advise them to try and convert their case note writing into proper sentences, so that helps them practice for their writing section while they're on the job. So it's quite useful, and that's something that you can try, particularly if you're still working and preparing for this test. I always advise people to go through articles and the. So you're supposed to know where you use where you use and, where you use the. If you go to our website www.teachyouracademy.com, there's a very good blog on how to use proper articles. Or you use before consonants, and you use before A, E, I, O, U. There's something which is an exception. So when you're using X-rays, you always write an X-ray rather than a X-ray. We often find that people struggle with that. So just be careful. We use the when we're talking about things that we already know about. So the clinic, the patient. So if you've already, if there's a specific thing that you're talking about, there's something that you're pointing to, then you use the. I often find that many medical professionals, they tend to use the quite a lot. So just try and go through articles. That is a grammar topic which we'll try and cover in our webinars, because I know everyone's caught up in self-isolating with the COVID. So we'll try and cover the grammar topics in our subsequent webinars as well. Tenses. There is a very good article on our website which you can go through. Tenses, you need to know where you use past tense, you need to know where you use the present tense, and you need to know where you use the future tense. I have had, she has had. So people often struggle with that. So they struggle with have had a lot. So it's I have had, you have had, she has had, he has had, they've had that. So these basic tenses are very, very commonly messed up. So try and revise your tenses, and try and revise your verbs, and try and correlate them with your letter. This have had thing needs to be corrected in loads and loads of students. Majority of the letters that we check, they mess up this. So make sure that that's something that you're working on as a priority. Basic spelling mistakes. Guys, we make a lot of spelling mistakes for things which are given in our case notes. If you are given the spelling for a drug in your case notes, messing up that spelling on your test is a mistake that should not be forgiven. If you've had spellings given in your case note, then use those spellings to check the actual spelling you've copied down. Please do not make these stupid mistakes. It creates a very, very bad impression. And you guys are doctors, fully qualified doctors, fully qualified nurses. You don't want to make basic kindergarten mistakes. It's just embarrassing. What we've done is, often people struggle with writing short forms. So you're given a short form on your case note, and you're supposed to convert that into the full form. So we've given you a handout on this masterclass on the common writing short forms, which you can download as a PDF and use that, and try and go through all of the short forms before you give your test. But if you don't know the full, for example, there was someone that we checked recently. They had a short form of GCS on their case note, so they converted that into Greenwich something. So Greenwich comma scale. So don't, if you don't know what the full form is, just don't use it. Okay. But I always tell my students that if you're not passing your OET writing, or you're getting very, very bad scores on your OET writing, the thing that is failing you is language. For people who are scoring below 250, guys, please look at your language, get your writing checked, because unless you work on this, you'll keep on wasting your money giving this exam again and again. All right. So now that I've depressed you with the language section, let's go through content. So content basically means understanding what the purpose of this letter is, knowing who your audience is. Are you writing to a GP? Are you writing to a psychiatrist? Are you writing to a surgeon? Are you writing to a district nurse? Are you writing to social services? You need to know what your audience is. So whenever, even if for example, if you're giving a musical performance and you need to tailor your musical performance to the needs of your audience. If you try and present a classical music presentation to a group of young teenagers, they won't really understand and they would think that what you're talking is irrelevant and they won't really engage with you. So similarly, you need to create a story which is interesting for your audience. A psychologist doesn't care about a patient's surgeries. He doesn't care about this patient's rare genetic disorder. What they do care about is whether this patient has had lots of divorces, lot of relationship problems, whether they're abusing drugs. Again, in the same vein, a surgeon doesn't care about how depressed this patient is. Sorry to sound rude to any surgeons who are in the audience right now, but you just need to alter your note to suit the needs of your audience. All right. Something that people do ask me a lot or ask my colleagues a lot is when they're writing a letter to a GP, do we need to include past medical history because this GP might already know all of that history? What I suggest is that if you think there's something which is extremely important in this patient's history, which is very, very relevant to your case note, or it's very, very relevant to your purpose, um, mention it. For example, we have a patient, for example, in a case note, we have a patient who's come in with community acquired pneumonia and they're allergic to penicillin. So they went to the respiratory specialist and the respiratory specialist gave this patient some other antibiotics. Now the GP would definitely already know that this patient has a penicillin allergy, but just to make sure you don't lose out points on your content and just to be comfortable around your letter, you can write things like, as you already know, this patient has a penicillin allergy. That's why he was started on clarithromycin. So this definitely makes a lot of medical sense. And as a doctor, I won't really be comfortable by if I skipped this vital information when I'm writing a letter to a specialist or to their GP. So mention that, but try and use as you already know, as you're already aware, or as you might be aware. So use these three sentences to try and simplify your life. So content, I always tell all of my students that you read the case notes twice. So so you already know, people who've already attempted the exam or are familiar with the OET the way OET works is that you get some time to read your case notes. You get about 5 minutes before you actually start writing. What I tell my students or what I tell my colleagues is that try and go through the case notes twice. So just if you take more than 5 minutes to read it, don't jump on writing the letter immediately. Read your case notes very calmly. Read them twice. This is going to actually save your time at the end. You won't have to just try and cut down sentences or try and insert sentences, and you won't really get nervous if you're familiar with the body of the note and you're familiar with what actually your audience needs, what they want, and what essential information they need to continue working. Now this goes to the opposite side. Clarity means is what information is not relevant to the to your audience. Again, going back to the GP example, telling a GP about this patient's past medical history, which is definitely not relevant. For example, if you have someone who's come in with the upper respiratory tract infection and they've had a appendicectomy done 15 years ago, telling that to the GP isn't really relevant. One, it's this information is not needed for the GP to do their job. Second, the GP already knows this. So if you include it, they'll cut down your marks, so try and skip it out. So when you try and go through your case notes, you read them twice. Once you assess what's necessary, the second time you assess what's not necessary. What some people like to do is in their mind, they try to underline the notes into relevant and not relevant. So you can try and do that and see if that works for you. Some people find that it reduces the time they actually have to write the letter, so they often run out of time. So work on that before you go to the exam. Don't use new techniques on your exam. Genre and style. This, unfortunately, is a thing that people do fail on, especially people who come from a foreign country. You need to be respectful of not only your seniors, but your colleagues and your juniors as well. For doctors, you need to be respectful if you're writing to a social worker or you're writing to a nurse. I know sometimes there is a cultural gap that when you're in your day-to-day practice and you're speaking to a social worker or you're speaking to a junior nurse, you might not be the most polite doctor, but if you do that on your OET, you're going to fail. All right. So you can't order anyone to do anything for you on the OET writing, as well as when you come and work in the NHS. Use words like I would request, please, I would be grateful. Sound nice, sound kind, and that's what makes you a good medico. Guys, when you do the last sentence on your OET writing is if you have, everybody's got a standard sentence, which is if you have any queries, do not hesitate to contact me. Please add a please to it. In case you have any queries, please do not hesitate to contact me. Try and be nicer people, at least on your OET writing. All right, now this is a question with lots of people asked in the beginning, which is layout. So this is a very, very basic layout that I've given you. There's again on our website, there's a very good blog on layout and how you're actually going to organize your letter, but this is a very condensed form of it. So try and organize your letter into some basic paragraphs. First, you start with the recipient's name, their address, current date. Current date, guys, you can either do the complete, for example, if the date is 14th of October 2019, so you can write either the whole thing, which is 14th October 2019, or you can do 14/10/2019. But just be careful when you write the date, you use the British format or the Australian format and not the American format. So it's date, month, and year. So don't mess that up. It's a very stupid thing to lose points on. Then you go RE and then you write the patient's name and date of birth. What some people like to do is they write the name and then they put in a semicolon and then they put in the date of birth in slashes. Or what some people try to do is they write the patient's name and then age it and then write the actual age of the patient. I would advise you guys to use a semicolon and the date of birth rather than age it. It just looks a little bit neater. And then you go through dear, Dr/Mr/MS. If you are confused with the gender of the person that you're writing to, which has happened to a lot of my students in the past, that they were confused with what the actual gender of the patient was, or of the doctor was or of the nurse was, then just try and write the full name. So dear Alex Stewart. So that's something that you can try. But if you are if you're confused with the gender, please do not just write the first name of the of the doctor or the first name of the nurse, because it just sounds very informal. So they'll cut down your marks on the style section. So just be a little polite and wary of that. Then you do your opening paragraph. um, Again, I keep on reiterating, guys, please sound a little nice. You begin with, thank you for seeing this patient. I would request your urgent assessment for Miss Johnson, who I suspect might be suffering from migrainous headaches. So see how nice that sounds. It creates a very good impression for the examiner, and if you go on to your daily life doing this every day, it creates a very good atmosphere, and it sets you on the right foot. If you write sentences like uh, assess this patient, I would like you, I want, I want you to see this patient. So just see how variable the tone sounds, and how what kind of a person are you coming across on paper. So just be a little careful. Then middle paragraphs, what you can do is, sometimes what we advise people to do is, you start from general to specific, and then you go on to most recent medications and therapies and the patient's response. So you're moving from general, so you start with the patient's general background. Miss Johnson has a history of uncontrolled hypertension, as well as a history of previous brain tumor resection in 2005. She came to me on this date, which will be your date in the past, with complaints of a headache. She was given conservative therapies in the form of paracetamol, to which she responded well. Then you go on to further visits. Unfortunately, she came back to me the later week with complaints of worsening headaches, and she underwent a CT scan, which was normal. However, Miss Johnson has not responded to our treatments and would therefore need specialist review and assessment. So that's how you're moving from general to first visit to your second visit. What some people like to do is, they try to break down these middle paragraphs into multiple paragraphs. So that's useful sometimes, because it helps provide a certain neatness to your letter. So you can try and do that and see if that works for you. Concluding paragraph, you state the specific reason for referral or request. For example, in our task, there was one task which was a patient with a subarachnoid hemorrhage that they were trying to refer for surgical coiling or clipping. So in the last paragraph, you can write that uh, I would request consideration of this patient for possible coiling or clipping if deemed pertinent by you. Guys, just note down this sentence, if deemed pertinent. It just sounds a little nicer when, for example, when I work as a medical registrar in the NHS, I often have to write letters to specialists, or I have to write letters to the GP to do certain things for me for patients who've been admitted under us. So even as a medical registrar, um, asking GPs to do certain things can be very awkward. So what we try to do is, we try to use this sentence, if deemed pertinent. The spelling is D-E-E-M-E-D. I'll again repeat it. D-E-E-M-E-D, deemed, and pertinent. P-E-R-T-I-N-E-N-T. That's P-E-R-T-I-N-E-N-T. So deemed pertinent by you. Deemed pertinent means that if you think it would be appropriate, because if you are a GP or if you are a medical specialist, you can't really order the other specialists to do things for you. They would only do things if they feel that it's right for the patient, because the specialist is the last point of contact. So the impertinent helps to add a little bit of politeness and a little bit of niceness to your suggestion. Especially, I find that sometimes we have junior doctors who are giving the OET writing, and when I try and assess their writing, they often put down wrong management. Um, See, on the OET writing, you won't be penalized for forming a wrong diagnosis, but you would be penalized for appearing rude. So if you're asking someone to do something which is wrong, then it just creates a messy situation. So just try and use that sentence, see if that works for you. All right. Now, what I suggest all of my students when they start preparing for the OET section or the OET test and they know nothing about the OET section. So the first question that we always get is how much time it will take me to prepare for the OET. It depends on you solely. I know some people who've got excellent English. If they walk into the English exam or walk into OET tomorrow, they're going to pass. They don't really need preparation. But I know some people who've been trying to give the OET for a very, very long time and they've got bad English, so they're failing again and again. So it depends upon you how much time it'll take you to prepare for the OET. What I always tell people is go through the official OET criteria. So we've given you a handout with official OET writing criteria, and I've tried to explain a little bit of it through this lecture. So go through it, see what they're asking you to do, get your baseline letter checked, know your weaknesses. We can do that at Teachio. So we charge 6.99 per letter if you're sending us a typed letter, and then that gets evaluated by a doctor or a nurse depending upon your specialty, and then it's evaluated by an English teacher to check your grammatical specifications, and then that helps us just know your weaknesses, so then you can start working on your weaknesses. But guys, I can't repeat this enough. If you've got bad English, you're not going to pass the exam. You need to work on the grammar topics which we provided to you. We'll try and do some sessions with an English teacher the next time, just to go through the grammar topics. And as a priority, I would suggest you to work on the grammar topics first before you try and think about, oh my God, what am I missing in content? Oh my God, what am I missing in clarity? If you've got bad English and if you're writing stupid sentences, you're messing up singular and plural, you're not going to pass. It if even if you're the I'm sorry if, even if you're the best doctor in the world, if you've got bad grammar, unfortunately this exam is an English exam, so you need to work on your grammar first. Keep practicing. You start with your official OET criteria. You go through the official OET letters, see what they're actually looking for, get a baseline letter checked to know your weaknesses, and then keep practicing. What I advise people to do is, if you find that your main thing that you are messing up on is language, you go through the grammar topics, give it at least 15 days of working on only grammar, and then going on to practicing letters again. There is no point in giving the exam again and again and making the same mistakes. It's a very, very expensive exam. If you're from India or if you're from Pakistan, you're spending at least half of your salary as doctors on this exam. So it's very, very expensive. So if language is a problem, 15 days of work on language, get a baseline letter checked, work on your weaknesses, and then get letters checked at a gap of at least 4 to 5 days. There is no point in giving multiple exams or getting multiple letters checked without actually working on your weaknesses, because you're just going to fail every time. All right. Now the floor is open for questions. I've had a lot of questions on the screen, which I was trying to ignore, but we'll try and go through everything. All right. Um, can you tell me how I can handle to choose relevant words on my letter? I felt so furious about that. So Ahmed, the main thing, if you're confused about what is the actual relevant points in the letter, look at your task first, look at who you're writing to, and then look at what they want you to do. All right, so you go through the task first, then you come back to your content. So in your mind you have an idea, okay, I'm writing to a GP, I am a specialist who's already seen this patient, and this GP has to follow this patient up in the community. So now you know on your content that you're supposed to tell them about why this patient was referred to you, what you did for them, and what follow-up they need. So your relevant points would be your first patient's visit, reason for their referral, their relative physical examination, the relative treatments which you gave them, and the follow-ups they need. So those would be your content. So what I advise for people who are just struggling in content is you go through your task first. So when you get your writing sheet, you skip everything and go right down to where your task is and find out your audience. There's a very interesting blog on our website which you can go through as well. Mr. Ali has asked 27/3/2020 admission officer admin Dr. Human regarding 40 years of age. Dear Dr. Newton. Ali, your format is correct. Okay. Unsa has asked, I didn't get paraphrasing. Can you please explain it again? So Unsa, um, we've given you a writing check sample, and you can also find sample letters on your official OET site. I'll try and send you guys some sample letters which we do on the Teacher website as well. So they'll show you that the case note contains sentence fragments. So on your case note, you'll have something like case history, or I'll type it down for everyone. So the thing on your actual case note would be like case note, hypertension into 3 years, well controlled. All right. So you can see on this is the way that your history will be written on your case note. What paraphrasing means is using this sentence fragment, you convert that into a proper sentence. So what I can do is, if everyone can send me what they think, how would they convert this into a proper sentence? And then we'll try and go through this again. What are the site for all right, guys, I'm waiting for you to paraphrase that case, the small thing that we've sent you. All right. Okay, I'm starting to get answers. That's good. What I would suggest as on this. Okay, excellent. So Gagan Ben Bansal has sent us. He has a well-controlled blood pressure for past 3 years. She has a history of hypertension, which is under controlled from 3 years. So Unsa, what you've written is grammatically wrong, because what not grammatically wrong, it doesn't sound right, because you've written that she has a history of hypertension which is under controlled. So there's a difference between under controlled and under control. Okay, so under controlled means that it's not controlled, while under space control without the led at the end. So under space control is right. So that means that it is normal. So the hypertension is controlled. If you're writing this on your exam, you're probably scoring quite less. All right. So make sure you don't use that sentence again. Ikra has written, he has a well-controlled on hypertension for 3 years. Ikra, this is again wrong. It should be, he has well-controlled hypertension. You don't need the in front of well-controlled, and you don't need on before hypertension. So guys, this is what you need to work on. I'm not trying to point out everybody's mistakes, but if this is what the essence of paraphrasing is. So what paraphrasing is doing, they're testing your ability to use tenses and your ability to use articles. So if you're messing these sentences up, then probably you're scoring very poorly on your paraphrasing. Zishan, the patient is hypertensive from 3 years, that is well controlled. Again, Zishan, it should be, the patient is hypertensive from 3 years, full stop. His hypertension is well controlled. That is well controlled sounds a little strange. Bakar, he has a history of hypertension which is well controlled. That's good. But you have to tell us the time he's had hypertension for. So it should be, he has history of hypertension which is well controlled since 3 years. Uneza says she has had hypertension for the last 3 years, which is well controlled. Excellent, Uneza, that's fine. All right, so very good. So we did a small exercise on paraphrasing. Belua Kirubai says she has a remarkable history of hypertension with adherence to medication since 3 years. This is something that as doctors or as nurses, we do quite a lot. Belua, you're adding history to the patient. It says she has with adherence to medications. I haven't really told you that the patient has been using medications. You seem to have added that on. So I know as doctors, you know that mostly hypertension is controlled by medications, but that's not really necessary. And using words like she has a remarkable history of hypertension means that there's something very, very extraordinary about it. Remarkable means that something about this history is very, very special. So hypertension is a very common complaint, and it's not really something which I would use the term remarkable for. So if you're using that on your sentence, Belua, you're probably adding words to your writing which aren't really provided to you. So you're adding your own history, and probably that's why you're scoring lesser points than you should. But your grammar is good, so just don't use too many words. Suganya says she has had hypertension for 3 years, which is under control. Suganya, that's completely right. I would say instead of writing 3 numerical, just write 3 as a word. Ahmed Farah said he has had hypertension for 3 years, which was controlled. Ahmed, was controlled. It sounds a little awkward. I would say that he has had is fine. He has had hypertension, or you can write he has had well controlled hypertension for 3 years. That should be fine as well. All right. So that's very good, guys. Thanks for participating in that short exercise. We'll try and go on to further questions now. I'll have to go a little back to see. All right. So Unsa, I hope that I've answered what essentially paraphrasing is, and you're able to point out to what your mistakes are, and you're able to you start working on your paraphrasing, you start working on your has had and have had and tenses, and then just go to our website. The website is www.teachyouracademy.com. If you go to our blog, you'll be able to find lots of information on what exact tenses you're supposed to use at different points on the OET writing. So I'll just type out our website's name to you. And then you should be able to find all of these grammar topics on our website. All right. Heba Hussain wants to ask, is there enough to draft the letter, then copy it neatly to the answer page? Heba, I would not suggest writing a draft because that's just going to waste a lot of time. And the 40 minutes isn't really enough for you to. What I would suggest is try and go through the layout that we've given you and make a structure in your mind that first I'm going to write a short introduction, then I'll go on to the first visit, then I'll go on to the second visit, then I'll go on to this, rather than trying to write again, because that's going to waste a lot of your time. What are the sites for articles or grammar? Ambati, thanks for asking that question. So you can go to our website, www.teachyouracademy.com. If grammar is a big concern for you, as it is for loads and loads of students, I would suggest that you buy books which are basic high school grammar or basic grammar. Where, Wren and Martin is very good. And then just go through the topics of articles, paraphrasing, tenses, and verbs. So these 4 topics, if you read from those books and try to do the basic exercises, you should be all right. Uneza Umer wants to ask, current date means exam day date or date of recent visit? Current date means, so the task will tell you what you're supposed to do if the task is set in a in the past year. For example, the patient's notes are from 2019, then you try and be closer to the last visit. Otherwise, if it's set in the same year, you can do it as in the exam date. So Ganya wants to ask, can you please explain regarding salutation, when to use Mr., Miss, age group? All right. So Suganya, in the UK, when you come and work in the UK, people are very sensitive about the salutation they want in front of their name. All right. So Miss for if it's a doctor, then it's a doctor. If it's a surgeon, sometimes they want to use Mr. in front of their name, but most probably in your task, it will state that Dr. John Hill or Mr. Jonathan Masters. So it will state this, it will state the title in front of their name. For females, use the title which is given to you. For example, in your task, it will state Miss Joyce Fernandez or MS Joyce Fernandez or Mrs. Joyce Fernandez. Please do not assume that someone is a Miss or Mrs. depending upon their age. You will offend a lot of people in the UK if you do that. All right. So just be careful of what salutation or what title is given in the case notes. If you get very confused or you're not sure, MS is the safest because it stands for both Mrs. and Miss. So you if you know it's a female and you definitely know it's a female, then MS is the safest thing to use. Could you please mention the organizational structure of the letter? So Belua, if you'll get a recorded version of this lecture, and I gave a organizational structure on this letter. But if you go to our website as well, it will give you a very nice blog on how you're supposed to organize your letter. Seti Soror wants to ask, do we need to use after who? For example, I am writing to request an urgent review for Mr. Smith, comma, who has been diagnosed with advanced cancer. I think your sentence is fine if you're asking about who, comma is fine, but SETI, it's advanced cancer and not advanced cancer. So just be careful about the kind of medical English that you're using. If you're struggling with medical English, I would recommend using a medical dictionary or going through basic articles in BMG or whatever local journals you have. It's sometimes we often find nurses and doctors as well struggling with medical English, using wrong salutations, using wrong spellings for cancer and cancerous and things that shouldn't really be messed about. So try and go through those journals if you're making basic mistakes like advanced and advanced. Bhavna wants to ask, oh, you've got the same name, that's good. Sometimes multiple visits are mentioned, how to write in an appropriate way. So Bhavna, what I advise people is that if you have multiple visits, only use visits which are pertinent to the specialist or the person that you're writing to. For example, if you're writing to a psychiatrist, try to use the visits which have something psychiatric in them or they have a mental issue in their visit. Do not mention things like came to me with an upper respiratory tract infection, came to me with an appendicectomy. But if you have if you have 3 visits for this patient, let's just try and go through an example. For example, you have your task is that you have, sorry, if you have 3 visits for a patient who's come in with one, this patient came in with a pseudo seizure. Second, the patient came with an upper respiratory tract infection. Third, the patient came crying to you saying she couldn't cope and she wanted to commit suicide. Fourth, the patient came in because she wanted some oral contraceptive pills. All right. So then you select, and you're writing to a psychiatrist, you select which of these visits were pertinent to the patient's letter. So I'll just create another open question, guys. If you want to answer, we've got a patient who has had 3 visits. All right. You have a patient and they've had 4 visits. You're writing a letter to a psychiatrist asking for cognitive behavioral therapy for this patient. The first visit is they came in with the upper respiratory tract infection. You gave them antibiotics. The second visit is they came crying because of a breakup and they wanted to kill themselves. Third, they came wanting some OCPs. Fourth, they came in after a paracetamol overdose. All right. So the question is, which will be the visits you want to mention? All right, we're starting to get some answers. We'll give it another minute to see more answers. Excellent. So Unsa was the one who was right. We'll use the second and fourth visit. Itumeleng is also right. Excellent. Guys who've selected two visits. So the first crying of obviously you'll include crying with suicide, but the fourth visit when she's come in with a drug overdose will also be relevant. If you're writing to a psychiatrist, things like drug overdose become relevant. For people who've just included second, I would probably advise that you go through your content path again and know which are the histories relevant and which are the histories irrelevant. You're probably messing that up on your exam as well. Excellent. We have a very intelligent audience today. All right. And if you're struggling with how to organize this, is what I advise people to do is that they go, if you've got two visits that you want to organize, you can either use two paragraphs. So you start, you on your first paragraph, you mention the first visit. And on the, one second, this, and on the, one second guys, the thing is getting repeated. Hello? All right, great. Sorry about that. So on the first paragraph, you'll mention the first visit when the patient came crying to you. And on the second paragraph, you'll mention that she again came with a paracetamol overdose. So you can try and split that into two paragraphs and organize multiple visits that way. But this does need a lot of practice, and this is something that we find people struggling quite a lot with. If they've got multiple visits, we find people get very confused on their OET, and they often, this is the one that I often see that when we have on the OET exam people being tested and getting multiple visits, that's the time I find a lot of students failing because they struggle with finding out which visits are relevant and which are irrelevant. Itumeleng wants to ask, how do I write a request for a patient requiring assistance with activities of daily living in a discharge letter? So Itumeleng, first we need to understand what exactly are activities of daily living, because that was something that I wasn't familiar with when I came to the UK. So activities of daily living are two things. You have your personal activities of daily living, which are things like washing yourself, cooking, cleaning, and then there are other activities of daily living like going out shopping, or putting out the trash. So basically, for people who are who've got advanced dementia, or they have some other problems and they're unable to manage, those are the people that we write to social workers to request assistance with activities of daily living. So if you want to request that to a social worker, you can use a sentence like, let me just answer that for you. I would like to please request you to provide assistance with activities of daily living for this pleasant lady. So that's something that you can try and use. We often like that quite a lot, using things like kind lady, pleasant lady. So that just creates a very good impression in front of the examiners that you actually care about your patients. And then it just creates a good score on your genre and style. Wingcam wants to know, if I don't know the recipient's name, I should write Dear Community Nurse, then I should end with yours sincerely or yours faithfully. All right. So on the official OET site, if you don't know the person, then you write yours faithfully, and if you know them, you write yours sincerely. But if this was daily life, I would say it doesn't make a difference. If you don't know the recipient's name, use their designation. Dear community nurse should be fine. Dear district nurse should be fine. Dear diabetes specialist nurse should be fine. But do not put in dear Mrs. Community Nurse. That's not right, because the community nurse can have any gender. So just using the title should be fine. Sometimes you write dear emergency registrar, or you write dear emergency consultant. So that's quite common. Said wants to ask, I am having problem with differentiation between had for possession and tense, and also when do I use past tense and past perfect? So if you go on our website, you'll find a very good article on when you're supposed to use past tense versus past perfect tense. Said loads and loads of people struggle with has had and have had. Has had, so it's always I have had, you have had, she has had, they have had. So try and memorize that if you're struggling with it. Past tense is used for something which happened in the past and has now finished. All right. Past perfect is what we refer to as has had or have had, is when something started in the past and it still continues. All right. So if someone has hypertension, then it's fine. Someone had an appendicectomy, so they had an appendicectomy in the past, but the appendicectomy isn't still going on. She has had hypertension for the past 15 years. So the hypertension started in the past, but it's still continuing. So that's how it's past perfect. Anu wants to ask us to post a complete letter. So we've sent you a writing check sample on your handout, so that should help, but I'll send you some more sample letters. Uneza wants to ask, we have to use synonyms for words in case notes, or we can copy the words from case notes. Uneza, you can do both of the things. If you know a synonym which is very good and it doesn't change the meaning, then you can use synonyms. Otherwise, you can just copy the words from case notes, as long as you're organizing it into proper sentences. Kalpana wants to ask, some blood tests were advised to be reviewed. Is this sentence correct? No, Kalpana, that sentence is incorrect. It should be, some blood tests were advised to be reviewed. But I'm not too sure what you mean by this sentence. If you mean that you did some blood test and you told someone else to review it, then it should be fine. But if you are the person who's reviewing these blood tests, then it should be some blood tests were reviewed. Aruna, it's correct to mention the exam date if the case note is not too much in the past. Wingcam Ewan wants to ask, if I'm writing to a social worker, should I include the patient's medical background? Wingcam, you can just give a brief, very, very brief sentence that this patient has a history of hypertension, diabetes, and peripheral neuropathy. But I won't really advise going beyond one line. Kalpana wants to ask what to use for a widow female, Mrs. or Miss. Kalpana, the salutation will be given to you, but if you're confused, MS should be fine. Ikra wants to ask, ma'am, is it essential? Because going back to Kalpana's question, lots of people who've lost their husbands, they use Mrs. While some people they go back to Miss. So it's a personal preference. So I won't really advise you to presume that because that just sounds very rude. Ikra wants to ask, ma'am, is it essential to start every new paragraph with patient's name? No, it's not necessary. You can either use the patient's name or you can use this lady, or you can just start the paragraph with something else. It's not necessary to start it with the patient's name. Aruna wants to ask, do we have to mention multiple visit dates on this date later in addition? Is it correct? Yeah, Aruna, that's completely fine. Sometimes what people do, they just write on and then they write the date in slashes. That is fine, but a better way would be on the 22nd of October, later on the 3rd of December. In addition, she also presented on the 4th of January. So you can try and use connecting words like this. That just might add a little points to your language section. But again, if you are someone who's just using word dates in slashes, that should be fine. Bakar wants to ask, could you tell me if there's another other lectures planned? Yes, Bakar, we do have future lectures. What I'll try to do is I'll try and cover, if people are interested, I'll try and cover some PLAB 1, PLAB 2 and MRCP topics as well. And we'll get some English teachers to cover some grammar topics, but we'll let you know. And we'll try and do CBT as well. Aruna wants to ask, do transfer letters come in actual exam? Yes, Aruna, they do come in come on the actual exam, and transfer letters are often quite tricky because transfer letters are from someone who already knows a patient to someone a patient is completely new to. So lots of point in history need to be included. So I would advise you to try and practice all the different types of letters. So you cover your referral letter, you do your discharge letter, you do your transfer letter. So try and revise all different types of letter before you attempt your OET. Aruna's capital small both should be fine. Ambati wants to ask, is it always good to write dear even for a consultant? Ambati, I had the same doubt when I came to work in the NHS, but it's completely fine to use dear for everyone that you're writing to. It is often considered a formal salutation. Seth wants to ask, I am asking, suffering is allowed or regarded as offend? Um, Suffering should, I mean, if you ask me in day-to-day life, is do we refer to patients from suffering from hypertension, suffering from diabetes? I won't really say that's wrong, but check the official OET criteria. Sometimes they consider that to be offensive. Uneza wants to ask, if I have to request some investigations like MRI, should I mention it on the intro paragraph or conclusion? Uneza, what I try to ask, what I advise my students to do is if they have any specific request, use that in the last, in the conclusion. And if you're doing things like referral or asking them to assess the patient, do that in the introduction. So the introduction is more broader and then your conclusion is more specific. For example, going back to the neurosurgical patient, I would suggest that in the intro paragraph, you include things like, I would request your urgent assessment for this patient. And then in the conclusion, you mention things like, I would request your assessment for this patient, particularly in consideration for surgical coiling or clipping, And I would also request you to please please advise for an MRI for this patient if deemed pertinent by you. Bakar wants to ask, he is a smoker who had a history of asthma since hypertension, which was corrected by Ventolin. Bakar, this is an incorrect sentence. It should be, he is a smoker who has had a history of asthma. So it is, I have had, she has had, he has had, they have had. So just note that down and try to memorize it. Aruna wants to ask, is it correct to begin with, thank you for accepting Mr. Johnson as my patient, whose clinical signs and symptoms are suggestive of ischemic heart disease. I refer this patient to you for your urgent evaluation and appropriate treatment. That's fine. But Aruna, I would advise that Mr. Johnson, the J should be capital. Just be careful around using capitals for names. All right. So actually, we're running out of time. We're actually over time now. So in case, guys, if you have any questions, um, please, you can go to our website, www.teachyouracademy.com. We do have our own writing check, which we get done by a doctor or a nurse, as well as an English teacher to evaluate your grammar, which starts at 6.99 British pound. So if you're interested, you can go to our website to get details. I would advise you to go to our blog to check out all the grammar topics. Aruna has asked for a transfer letter sample. Yes, Aruna, we have some samples on our website. If you want official sample, you would have to go through to the official OET website to get all types of transfer letters. So that should be all right. Okay. Again, guys, if you have any questions, just let us know. You can email www. So I'll give you the email address. It's teachyouracademy@gmail.com in case you need any further details about the courses that we provide. We'll let you know about future courses. Auneza, so we're giving the last question now. In emergency referral letter, if all visits in case note are with same symptoms, we have to mention most recent visit, or we can write with initial visit. If Uneza, if they're all the same symptoms, I would advise that you write that this patient has come in with multiple visits starting from the first date and most recently on the second date. All right. So guys, that's it for today. We'll let you know about future lectures, which will, again, we're trying to give lots of free lectures because I know everyone is quarantined. Is there any grammar helpline lectures? Yes, Doc Sammy, we're trying to do grammar lectures. We'll try and get an English teacher the next time. Because they're the best people to tell you about grammar. I'm the best person to tell you if you've got any medical problems. Uneza wants to ask, please arrange a speaking class. Yes, I'll try to do a speaking class myself, just to go through medical communication, and we'll try and do something grammatical as well. All right. So guys, that's it for today. If you have any questions, it's teachyouracademy@gmail.com. And please go to our website and try and go through our writing check service. It's really good, recommended by me. And we'll keep you posted about future lectures. All right, that's it for today. And I hope you guys do very, very well. Good luck and stay safe.